I'll let you take it away.
Yeah, thanks. Thanks everyone for taking the time. Can I ask everyone to mute really quickly? We hear some background noise. Thanks. So just for all of you who are not aware, my name's Katie Baker. I'm the executive director of FAIR Idaho. FAIR stands for Food, Agriculture, Restaurants, and Establishments. Sorry, I'm looking real quick. We have one person. Okay. Sorry, the background noise was getting me. So thank you so much for being here today. We're so excited to invite NICE Healthcare and the practitioners to join us and really just talk about how the program is to utilize and how easy it is to get going with NICE Healthcare, and then also we hope you're excited about this member benefit that we offer for FAIR Idaho members. We're really excited that it's worked out so well thus far, and it's relatively new to our organization. So thank you so much for taking the time. I'll let Paige take it from here.
Thanks so much, Katie. Hi, everybody. Thanks for joining our NICE and FAIR event. FAIR has been such an amazing partner so far, so we're excited for 2022 with all of you. And I will bring us through our itinerary today. So what we want to do is give you a little refresher about NICE Healthcare. For those of you who are already familiar with us, and those of you who don't know, share with you some of the basics about NICE. We'll dive into a couple of how-tos that you all have voiced wanting to hear about, and then we'll open it up for some questions. I'm also thrilled we have a FAIR member to give their own testimonial and experience to share. So we're excited about that. And then we'll finish out with meeting our awesome Boise clinicians as well as one of our clinical managers. So wave hi, awesome clinicians. All right. Before we get started with that, I also wanted to introduce, for those of you who don't know her, Lindsay. Lindsay is our partner and is the boots on the ground in Idaho. Her team is who you can reach out to post this webinar if you have any questions. So hi, Lindsay.
Hi, Paige. Hey, everybody. I am Lindsay, the consultant here at the Chandra Group that helps you set up your plan and also train your employees on how to utilize NICE Healthcare. NICE is truly the easiest benefit you're ever going to implement. So fantastic to engage with their service team and also, my team to help with any of your questions. But when you click that you're interested in learning more about NICE, then you get a call from me, just so you know. And I don't know if you want me to say more, Paige, so just let me know.
That's perfect. That's perfect. And Katie, post this meeting, will share Lindsay's contact information and the page where you can access the interest form that Lindsay was referring to. All right, so who are we? Who's NICE, guys? NICE began as a way to remove the barriers of primary care, the wait times, the unaffordability, the inconvenience, and we built out an integrated healthcare option that makes it easy on employers because it's a fixed rate and it's all included. So what's included then? Well, everything on the screen is included. So our primary care model includes virtual and chat, which covers about 70% of a patient's needs on average. And then we also have in-home care within our service areas. And then through our primary care clinicians, we offer labs, imaging, x-rays and ultrasounds, pharmacy with over 550 free medications in our formulary, virtual physical therapy, and virtual mental health. So these core offerings are where we think integrated health should start, but we go one step further because it's also nice, pun intended, when you don't have to figure out healthcare on your own. That's why we also include care coordination, like you see on the bottom right hand, and specialist referral on the bottom left hand of the screen. Our care coordination team is there to answer any question and support the needs of our patients to make healthcare an easy experience rather than something you have to navigate through, which I think we're so used to doing. Our specialist referral team allows the patients who need specialist level care to experience how easy that can be. I, for one, prior to NICE had wait times of a few weeks to be able to get through a specialist referral, and it was all on me. So this to me is a big deal. Lastly, because NICE believes in our patients as whole people, we know that those you surround yourself with is often a significant part of your life. That's why NICE includes the entire family, ages 2 to 65, for one standard rate. For NICE, your family is anyone who lives under your roof. So if you happen to have your sister living with you and you two tag team your children, like one of my best friends does, you, your sister, and your kids are covered. So coordinated, seamless, integrated, and as a Fair Idaho member, that rate is $28 per employee per month. In other words, $28 per family per month, as we like to know it. All right. I understand if you don't just trust me on how awesome it is, because I work here. So I obviously think it's great. But you should trust our patients. So there's a lot of stats on here. My favorite one is actually great care is better than your previous clinic. That's not everyone's favorite stat on here. I understand all of them are awesome. But it's my favorite because people have all sorts of different clinic experiences, and 98% of our patients feel that NICE is better than all of those. Part of what makes us better is our engagement team. Our engagement team is here to work with the employees and employers to help tailor NICE education, training, and connection to what your company needs. So we also, of course, have an incredible clinical team who you'll have a chance to meet shortly, who also makes a huge difference. And that's where you're also seeing our NPS score, the utilization, because people enjoy them and they're very good at their jobs. All right. Now that I've acclimated you to what NICE is and what we're all about and what's included, I wanted to touch base on how NICE works. This is the part where you all had asked some specific questions around this. So the first thing I wanted to go over is how easy it is to schedule a NICE visit. Once you download the NICE app and fill out your intake form, think of a much easier registration questionnaire process. The primary navigation buttons are on the bottom there on the image that you see. So you click on the appointments button. Once you click on the appointments button, from there, you'll see a blue button that has the plus sign that says book appointment. That's how you book your appointment. Once you've scheduled an appointment, it will show up on the screen, and from there you can schedule, join, cancel, or book a new appointment. So all of that from this one screen. If you need any help, even though I know that sounds pretty easy, right? But if you do need any help, the chat function at the bottom of the screen is linked up to our care coordination team that I spoke about earlier, and they can help you with anything you need. All right, once you have a visit set up, which you would have selected chat or video to start with, that's where the clinician will go over your patient history, medications, all the other necessary aspects of your care visit. The biggest difference you'll notice is the time. Where the average clinic has you spending less than 8 minutes with a provider, we average around 37 minutes just because we care. And if a home visit's needed, that's about that 30% of the time. NICE will set that up with you. Some examples of home visits would be a physical exam, blood draw, an x-ray that's needed. And our home visits are where you have a chance to meet our wonderful Idaho clinicians in person, outside of today's webinar, where you get to talk with them some face-to-face, the in-person meetings. These are the people who will come into your house. After the initial visit, your care plan will be developed, which you can access and see. Any scripts that you'll need will be sent to your local pharmacy, or for chronic medications, sent directly to your home in 3-month quantities. And if physical therapy or mental health is needed, then a referral will come through for that, and same with specialist referral. And yes, it's that simple. So we wanted to give you an opportunity to hear from an actual NICE member who's a part of FAIR about their experience. Is Melinda on?
Hi, I am. Sorry. I'm on-
Perfect. No, thank you. Melinda,
Hi.
thank you for joining and thank you for being here. So we wanted to give you the opportunity to speak
Okay.
about your experience. Thank you.
Well, I'm an employer, and I think I was the first one in Idaho to sign up for NICE because I think it's an incredible add-on, a great way to attract employees, which, as we know, especially I own a restaurant, especially in the restaurant business, has been extremely competitive and will continue to be for a long time. So it's really great to be able to put in our ads and say in our interviews, you get healthcare from the day you start. And people are blown away by that. I've had nothing but fantastic responses from our employees. Like you had mentioned, one of your statistics is about rating healthcare compared to previous healthcare experiences. And I had one cook, lives with her 2 daughters, and they came to her house for, I don't know what, some strep test or something. And the clinician said, "Oh, when's the last time you guys have had a checkup?" And they're like, "Oh, it's been forever." So she gave all 3 of them checkups. And our employee was just like, "It's the best healthcare she'd ever gotten, like in her life." So
Amazing.
anyway, so yeah, I've just heard nothing but great things all the time that everybody spends with their patients. I had one guy that works for us hurt his wrist, and not at work, but some thing at home, and got on the phone, and they like emailed him like, "Here's some cool wrist braces you can get off Amazon that aren't too expensive, and some exercises you can do." So I mean, just kind of the follow through and the detail, and I just can't imagine a doctor emailing me an Amazon link for a wrist brace. They would just give you one and then charge you like $80 for it. So when we onboard our employees, and they're going through all the paperwork, we actually make them put the app on their phone when they're sitting there. Just because know that even though they're reading about it in the employee manual or we're telling them about it, until they, it's just convenient. You just need to have it on your phone. So you just, if you're going like, "Oh, I feel kind of well, maybe I should get in touch with NICE," so you'll forget about it. So we just have everybody do that, and part of the onboarding process. And I think that's really helped with engagement on our side. So anyway, I don't know what else nice I can say about it, but
thank you so much, Melinda.
Yeah,
and thanks for sharing
No
your
problem.
experience.
You bet. My pleasure.
I can't wait to come out there. I'm coming out around Tree Fort, and so I'll make my way over to your restaurant.
You bet. Thank you. Okay, cool.
Okay, so before we get to our amazing clinicians, are there any questions on what we just went over? We'll open it up for a few questions. And Katie, if there's anything that was in the chat, I can't see while I'm sharing my screen, if you wouldn't mind.
Yeah, I think I'm the only one that added email addresses and a link to the NICE Healthcare Fair Idaho page for everybody to reference too. But yeah, feel free to put any questions in the chat. We have time for a few of them, I think, or just raise your hand and we can call on you.
Hi.
Hi.
I wanted to ask a question about the mental health component. I think that's probably the thing that's most attractive to me, as we have a lot of people in the service industry, and I know this is probably common for a lot. We have a lot of burnout among our staff and a lot of people seeking counseling and without insurance, just trying to figure out how to go about that. So I know you have to do the primary care visit first, and then you have the referral. But I was just curious about what that process is, if it is possible to have ongoing healthcare, mental health care, as you would with a normal counselor.
So the way that it's set up with NICE is that the goal is to address the needs of each patient specifically. And so they work with their provider and with the mental health therapist to be able to coordinate how frequently they need to see each other and what that length looks like. Typical things that NICE functions around in mental health is like depression, anxiety, work stress, job change. I'm sure none of us have had any of that the past few years. As you can imagine, it's a popular ad, and something that we actually added due to need. So it's a little bit different than your standard implementation of mental health, because our goal is not necessarily to keep people there indefinitely until the end of time as a regular person in mental health. It's to help them address their needs.
Okay.
We don't place a limit around what that means. We help coordinate that with the patient together.
Okay. So if it was an issue that they wanted to pop back in about more frequently, there's not a cap necessarily.
Yeah, there's not a cap. There's a collaborative approach to it. And then the other piece around it is, let's say it's something that ended up needing specialist care. Let's say they have something that's kind of going far and beyond that would generate a referral from our mental health team to somebody that has that specialist. The same way that we would refer out to a specialist for primary care. Think of this as kind of like primary mental health needs. And then anything that's kind of more intensive that really needs that specialist or that focus, that would go to there.
Okay, perfect.
Great question.
Thank you.
All right, are there any other questions? Give it about 10 more seconds. And we'll meet the clinicians.
Yeah, see, because you just understand how simple it is. You're all too smart.
It is pretty easy.
Okay.
Right.
So, time to meet our clinicians. Who's excited? I am. So I'd like to introduce you to our Idaho clinicians. Please meet Jessica and Alyssa. Jessica and Alyssa, wave. Jessica is on for care, so I'm going to introduce her on her behalf through my voice, but she came on screen. Hopefully, I don't know if she's still on because my screen doesn't show me that whole thing. But I hope that she was able to join via video so you can see her face real quickly. So Jessica lives in Meridian, Idaho with her husband and 2 teenage sons, and her family has lived in the Treasure Valley for generations. So she's one of you all. Jessica loves activities and the peaceful, quiet lifestyle connecting to the beauty of Idaho. In the summer, she likes to bike on the greenbelt, paddleboard, and jet ski. But most often, you'll find her on her patio in the hammock, which sounds amazing, with a book, sweet tea, and a dog or two. Or you might find her similarly lounging in a pool or lake, usually awkwardly with an umbrella. I can picture that, Jessica. Jessica has a long career in healthcare, starting out in healthcare as a tech and then an RN and moving on to become an NP focused around family. She spent time in family practice, urgent care, pediatrics, ENT, brain injury care, and occupational health. I wanted to read a quick quote she sent about working at NICE with all of you. She said, "Working at NICE has been a great experience. Many of the constraints of a typical healthcare are not imposed. I am given the time to discuss multiple issues in longer than standard visits in multiple modalities. I appreciate the ability to consult with multidisciplinary team. My favorite thing, however, is home visits. People are more comfortable in their homes and I get to meet extended family members, spouses, children, and pets." Thank you, Jessica, for joining. Feel free to go back off screen and get back to the care, but thank you very much. I'm going to stop my screen share so that I can make Alyssa's face nice and big for everyone. 1 second here. Okay. Oh, there we go. Okay. And now to meet Alyssa, our other fantastic Boise clinician. Alyssa, tell us about yourself.
Hi there. Thank you, Paige, and thank you to everyone from Fair, Idaho for being here today. My name is Alyssa. I live on the Boise bench with my husband, 4 school-age boys, 1 dog, 1 cat, and reasonably sized flock of chickens. Just can't beat those eggs. My past experience as an RN, I worked in pediatrics in the hospital, loved taking care of children, but as a lifelong learner, felt really passionate about returning to school to get my doctorate degree as a nurse practitioner. So achieved that at Idaho State University, and I've been working with NICE Healthcare since they launched here in the fall. I feel really excited about this partnership and have enjoyed, getting into the community and meeting lots of the employees that we've contracted with already. And
I bet you know some of them, right? I bet you know some of their restaurants, which is cool if they share that. What's your favorite thing about Idaho?
My favorite thing about Idaho would be we enjoy so much that, we get all the perks of a big city, meaning like wide access to all the different kinds of entertainment and the arts and museums and amazing restaurants. But we can drive 40 minutes out and be in the wide open nature. So we're big time skiers, love the lakes, love walking on the green belt and all those activities.
I keep hearing about walking on the green belt. Last time I came to Idaho, that was mentioned. Now, Jessica, now you, I think I'm going to have to spend some time there.
I hope you get in contact with me when you're here and we can do that together.
I will. Yes. Illinois is nice and flat. So, and city.
Yeah.
Oh, perfect. Thank you. Tell us a little bit about how's it been so far at NICE? What's your experience? What do you think?
It's so interesting to me because, like Jessica said, and so many of our other providers, the ability for us to provide comprehensive and convenient care to patients is just, it's so amazing. And as I was thinking about this conversation we were having with restaurant owners and people, I was imagining like an analogy of people trying to make a reservation at a restaurant and hoping to go that night, but then being pushed out 3 weeks. And then when they arrive and they're at the hostess station, they're told, well, you've made a reservation, but you still have to wait an hour. So, and then once you get to your table, you sit down and you're told, you only have 15 minutes and you can order one thing. And that's the experience. And I find that like a lot of my colleagues who work in traditional clinics, they are functioning under this kind of stress where patients are expecting to have, quality care, but they're rushed, they're waiting, and it's really hard to provide any kind of good experience in that kind of a situation. So it's just such a blessing to work for a company that prioritizes patients and employees as much as NICE does. I love my job so much, and I'm really, really excited to connect with more of our community members and serve you and your families.
Oh my gosh, what an amazing analogy. Isn't that so true how we're conditioned, and such a good way to help us understand the things that patients go through on a regular basis as norm.
Yeah.
I'm so glad we're not like that.
It's really frustrating as a patient and really hard as a provider. So
yeah. Oh, amazing. Thank you so much, Alyssa. And thank you for joining and taking time out of your day and from your patients to join more patients and this awesome group of folks. I have one more person to introduce us to, and that's Mary. Wave hi, Mary.
Hi, everyone.
Mary is a clinical manager at NICE. So Mary, I figured maybe you could introduce yourself and also tell everybody a little bit about the coordination between the clinicians at NICE.
Sounds good. So hi, everyone. My name is Mary Essen. I am one of 4 clinical managers here with NICE Healthcare. As Paige mentioned, I have been in healthcare for over a decade. I started off as a tech, med passer, RN, and family nurse practitioner, and now as a clinical manager. So I've kind of been in most of the roles. I'm very excited to be here and to see all the faces on the screen. This is very exciting. One of the best part about NICE Healthcare is the collaboration, as Paige alluded to. And it's very exciting that we have Alyssa and Jessica who live in Idaho to serve as more of the boots on the ground in Idaho. But also we have many more clinicians at Nice Healthcare that you might have the pleasure of encountering if you do schedule a virtual visit. And note that with all the encounters, you have the ability to also choose the provider that you want to work with as well. And outside of the ability to choose the provider of your choice, we work in a team-based approach or a team-based model of care in which the providers, we all coordinate efforts among all the healthcare teams in order to provide the patients with the best care possible. So we all get to communicate among each other and bounce ideas of each other if we need to. So that is just my little spiel on Nice. And I'm not in Idaho. I don't get the pleasure to be in Idaho. I live in Wisconsin. So
I didn't even realize we were so close in proximity. Well, that is so fun. I guess, Mary, you and I can plan a trip to go visit everybody together.
sounds exciting.
Yeah. That's one of the best things is exactly what Mary talked about, is being able to have that much connection. It makes a big difference to have something where all the clinicians really know one another, spend time together and help coordinate on care plans. And when you're a patient, if you choose to have multiple clinicians within your time at Nice, they are super integrated. So same with our service line. It exists the same within our clinical team. Both of them are highly integrated approaches. So that's it, guys. These have been our amazing, wonderful Idaho in-home clinicians, awesome clinical manager. And if you have questions that are beyond the 0 questions that you had during the presentation outside of the one excellent mental health question, feel free to reach out to Lindsay at Chandro, or you can reach out to Katie. She knows how to get in contact with all of us. And then all of us here at Nice are here for you.
Yeah, thank you so much, Paige. I'm just to let everybody know, we're so excited to work with Nice. I mean, I think from the very beginning with Fair Idaho, and we're a relatively new nonprofit, really a trade association, we were trying to think of creative ways to offer our members benefits. We're very much a think outside of the box type of organization. And so we're happy that this is an affordable solution that seems to really help employers attract and retain staff, as Melinda well said. So anyway, thank you so much for being here. I want to make a small note that we do have practitioners here in the Treasure Valley. And I believe that's a 35-mile radius that they travel. Is that correct, Paige? Not if I got it right. Okay. But we are a statewide organization, so we do want to offer this benefit to other members across the state. We have a lot of folks around the state that would benefit from this and having practitioners in the area. We do need 500 humans in any given area to place a practitioner, but the telehealth option in the meantime is a great solution. So just wanted to add that side note that that's what we're working towards so that we can offer it to more of our members. So thank you so much for taking the time today. And my email was in the chat. If you have any further questions, I can definitely lead you in the right direction. So thanks so much.
Thanks all.
Yeah.
Have a great day.
Take care.